Namaste, I'm Dr. Sunil Richardson from Richardsons Face Hospitals. So, a lot of our viewers, subscribers, patients, and even doctors have been requesting us to come out with the case presentation. So, we decided from today on to come up with case series. We hope to come up weekly. And what we're going to do in this case series is just taking one patient from a whole lot of patients that keep visiting us, and we'll take you through that patient's journey with us. It could be over a few weeks, it could be over a few months, or sometimes it's even over a few years. And then we'll tell you the transformation that we've achieved. We're going to tell you the whole story, what transpired behind the scenes, how we went about planning, execution, and how the patient left us at the end of the treatment. All right. So for today, we have this guy. So it's interesting to note that before he came over to us, he had had 17 earlier surgeries. Yes, absolutely, 17. He was born with a cleft lip and palate. He had his primary surgeries in the Middle Eastern country of UAE, and then his dad got some other secondary surgeries in the neighboring Saudi and some other countries in the Middle East. Now, he had a lot of issues with the way he looked. He was a very bright man and he wanted all of that sorted out. He contacted us, and I want to show you first up how he came to us. And you can see that that's how he came to us. So you can see he was not looking too bad, but there was some issue with his nose. He had some problem with his upper lip. He had a little bit of a speech concern, speech issue, and his smile. This was the main concern as we saw. Now, obviously, one of the things that we do for all patients here is we do a mandate picture. We make sure that the photographs are taken, scans were taken, and then we eventually came out with a comprehensive, specific, tailor-made treatment plan for this gentleman. So in this, the first thing we decided was to get his upper jaw forwards. Why? Because it was short and the nose rests on the upper jaw. So we wanted to get the upper jaw forward. That's what was done for him. You can see in the first stage. So we did an anterior maxillary distraction. And this was not only to improve the facial balance, to improve the facial aesthetics, but also to improve his speech. All right, after which we also planned revision with his lip and a cleft rhinoplasty. So this was done in the second stage, and our dental team came in and did some kind of dental rehab. And then we also put a little bit of hair on his mustache and little areas on his beard that he wanted. So that was a two-stage. So he got his first surgery here. He went back to the Middle East. He came back to us, I think it was 4.5 months hence. And then we did his second stage. He stayed with us for about 2 weeks before he got back. So this is all his upper lip. This is the second stage that we did. And some of the pictures during his second stage, which we had to do, was to harvest the rib. We had a lot of need for a big amount of rib harvest. And you can see the transformation in the nose. So we've gone from something like that to something like this. And again here, very, very large bulbous tip to a tip that looks proportional, normal looking tip. And that's what we could get. So you can clearly see that it was evident with the photographs and also with the scans that we made a huge improvement in his aesthetic outcome. And also not only that, he was so happy because this was something that was not just changing the way he looked, but he improved his self-confidence. I did tell you he was an intelligent guy and he was going to get new job in the Middle East. And so we did a very minimal lip revision. You can see that as well. This was when we did the lip revision. And then we did the mustache transplant. I already told you that was the third step of surgery that we did, but in his second visit. And here we put in about 250 graft on the scars of his upper lip. And that's what you see now, the before and after. So the changes from here to here is remarkable. From having deformity in the middle third of the face, having a low self-esteem, not wanting to show his face to the people outside, always wearing a mask. He was telling me that COVID was a boon for him because he would wear the mouth mask. So from there to a guy who was really confident, who had much clearer speech, perfect lips that others wouldn't notice the scar, good nose. So we've taken care of his entire face, me and our team here. It's not just done by me, the entire team that took care of him over the stages. And you can see the before after results. So this basically gives you the idea about how we can change the face, the nose, and therefore, as in this case, he told us it was a new life, a new beginning for him to look forward to. He's going to go back to the Middle East. He left us a few weeks ago after everything was done. And since there was this need or demand, many of the patients and many of our viewers are asking us for a case series because, we're showing lots of bits and pieces as the patient come in, but we haven't got a full compilation kind of a series of videos being done. And from now on, we hope to do this. So my junior doctors, they're going to prepare everything about these patients. And do remember, we have very extensive, exhaustive documentation with us, be it photographs, videographs, or even any kind of scans. So all of that will get compiled. So do watch on this space on our channel, and it would be where we would be explaining about complicated cases, case series, so that you will be able to understand how in reality we are able to transform these patients' lives, change these patients' faces, improve their self-confidence, and also be able to get an idea about the journey that they're going through, an idea about the pain they go through, maybe the discomfort. Yeah, everything is involved in this kind of a major face changing procedure. So hope this video was useful. And I think every week, that's what we hope, as I mentioned earlier, to come up with these kind of series. Thank you. If you have any more questions, queries, you want us to come up with any of the different kinds of videos, do let us know, and we'll be more than happy to oblige. Bye-bye.